Hi, my name is Boyd. I have received 2 kidney transplants in my life. The first one was in 1992 from a deceased accident victim. Then in 2013, 7 years ago, my son and I participated in the parent exchange program where my son donated into the chain and I received the kidney from the chain. My kidney disease was diagnosed when I was a teenager. I lived in a remote rural area in Saskatchewan, and this was back in the early 1950s, and I had had several strep infections that had caused damage to my kidneys, and then when I was a teenager, I was diagnosed with glomerulonephritis, which is a slow deterioration of the nephrons in the kidney. And so the disease progressed into my adult life, and fortunately for me, I didn't need a transplant until I was in my 40s. By then, my kidney function had declined to the point where the toxins in my blood were too high, causing various problems to develop. I had dialysis for 2 periods of time. In 1992, before I received my first transplant, that period lasted about a year. And then again, before I had my second transplant, I was on dialysis for 7 years. That was from about 2007 to 2013. So in both times I was on hemodialysis, and my wife Jenny and I were trained to be able to do the dialysis at home. In the first case, I was working and had a job which required travel as well. So doing dialysis at home enabled us to have the flexibility to do the 4-hour treatments 3 times a week and do my travel at the same time. In some cases, I had dialysis at other centers when I was gone for longer than 2 nights. The second time I was on dialysis, I was retired, so Jenny and I were trained for nocturnal dialysis, which was a more effective treatment, and we had a dialysis machine next to our bed, in which I would be connected up to at bedtime and then do the dialysis overnight and disconnect in the morning. When my first transplant failed in 2007, Jenny and I were trained to do nocturnal dialysis at home, and this is what I did for several years. And then about 2010, we became aware of the parent exchange program at UCLA, where through Dr. Jeff's father. And so we went over to UCLA, and we were both evaluated, and Jenny's kidney function was fine for her, but was marginal in the sense of her donating one of her kidneys. So we dropped the idea at that stage, but by then the program in Canada had been started under coordination from the Canadian Blood Services. So by then my son Jason expressed a willingness to donate through the program, and Jenny and I were reluctant for me to receive a kidney from my son, since I was in my mid-60s by then and my son was about 40. And so anyway, he insisted that he was willing to proceed and wanted to do it. So we got over our reservations, and we signed up for the Parent Exchange program, and this was about 2012, and the chain was put together once and fell apart, and then in the fall of 2013, we learned that another chain had been put together. There was a concern about me in the sense that I had antibodies from my first transplant that made finding a suitable donor particularly difficult. But in any event, everything was ready to go in the fall of 2013, and we participated in a parent exchange program, and I got my second transplant, and my son Jason was the donor into the chain. Even though I had some concerns about my son being a kidney donor, we were grateful, my wife and I were grateful that he had been stepped forward and was willing to donate, and so we decided to proceed with the parent exchange program. With both of my kidney transplants, the first one I was 45 years of age, and the second one I was 66 years of age, I was quite calm going into the procedure. I had faith in God and faith in the skill of the surgeons. I was grateful to my son for his willingness to participate in the parent exchange program. And I also knew that kidney transplantation is a procedure where you end up in better shape than you were before, because of the result being a proper functioning kidney, which I had not had for some time. Normally, the procedure of my son donating a kidney and me receiving a kidney from the parent exchange program occurs simultaneously. In this case, my son was in a different city, and the procedure of removing his kidney was done the day before, and we were able to talk to him, and everything was going well with his recovery when I went into the operating room to receive a kidney the next day. As far as recovering from the surgery is concerned, I had two different experiences, the first transplant and the second. The first transplant, after the first transplant, I did have problems with rejection that came on within the first few weeks. It was a struggle to maintain the function of the kidney and to keep the kidney from being rejected. After that as well, there were fairly frequent adjustments to my medications that were required, and I went through periods where I did not feel well because of what was going on. Eventually, I did recover most of the kidney function after the rejection episode, and the kidney did last me 15 years. The second transplant, which occurred in 2013, has been much smoother. I did not experience rejection. I had normal kidney function pretty much from the get-go, and had all the benefits then of a properly working kidney. And that has continued over the 7 years since I've had the surgery. I have normal blood pressure without taking blood pressure medications, and I have very stable blood results. I think that compared to the first time, and when I was transplanted the second time, I probably had a better match with the kidney that was donated to me. The rejection drugs had improved, and I think I was on lower doses of immunosuppression. Being older, my immune system was less strong, and probably didn't reject the kidney as strongly. So whatever combination of these factors were, I did have a very good recovery, and my kidney has functioned very well for the 7 years that I've had it. Having received the transplanted kidney and having it working well, freed my life for travel and other activities like playing golf. The new kidney was working very well, and there was some travel we wanted to do, and Jenny and I, and for instance, we were able to visit our son and his family in Korea, and one thing that I'd always wanted to do was to visit Spain and Italy again. So we had a nice trip to Spain and Italy. I had traveled extensively before, but Spain was one place I hadn't been and enjoyed going to. So along about this time, I developed a heart condition called atrial fibrillation, which required taking a medication to slow my heart rate down, and also required blood thinner. So this limited my ability to do certain things, but I was able to resume a normal life and enjoyed doing the things that I'd always been limited on when I was on dialysis. It has now been 7 years since I received my transplanted kidney through the paired exchange program, and I'm feeling great. The kidney is working very well, and I look forward to many more years of enjoying seeing how our children and grandchildren grow up, and of course our sons are all adults now, but we're able to continue our life together. My wife Jenny and I are coming up on 52 years of wedded bliss, so the future continues to look good for us. I now have a special relationship with my middle son Jason, a bond that's been formed as a result of him donating a kidney so I could get one. And I've learned to be grateful to God, and also to, of course, to my son. And I've learned that it's important to accept the generosity of others, as well as to be generous myself in other ways where I can contribute. So it's been an experience of learning God's generosity and also the generosity of other people. Over this journey, which has occurred most of my life while dealing with kidney disease, I've learned the importance of my Christian faith, the importance of being willing to accept the generosity of others. You need to listen to medical professionals, and also the need to be totally compliant on the medications which I take to prevent the rejection of my new kidney. My advice to anyone who needs a kidney is to maintain a positive attitude and to actively pursue both the living donor and the paired exchange program if there's no living donor available that is a match. And I think you should make relatives aware of your need, but obviously not to put pressure on them. They need to make up their own minds. And in my own case, I'm very thankful to God, and I'm thankful to my son, and to the professional medical people that made all this possible. The first kidney transplant that I received when I was 45 years old enabled me to get through the remainder of my work career into an early retirement situation. And then having gone back on dialysis, I then received a second transplant, which has enabled me to have a more enjoyment and a fuller retirement life with Jenny. We're now coming up on our 52nd anniversary. Had a wonderful 50th anniversary celebration with our family in Hawaii, and I continue to be able to enjoy our family and our activities, and look forward to more years together. And then our Christian faith has look forward to a bright future beyond that.